Hello, everyone, and welcome to Question Lab. We're happy to have you here again this evening as we discuss the topic of high yield anatomy. Leading our discussion once again is Dr. Paras Bakaria, and he's going to introduce himself to us now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back to do medical school. I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach is our coaching and tutoring program. We work with students one-on-one to help them on their academic journey. We'll talk more about that later, but what I want you to know for now is that the methodology that we will employ as we dissect 4 questions this evening on the topic of anatomy is very similar to what we do in RX Coach. So without any further ado, let's get into our first question of the evening. As you can see, the answer choices are not present. That is by design. We remove those because we don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you're unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've removed those for you. After we do that, we'd like to move in. We'd like to begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking before you read that vignette, so you can pick up on all those relevant clues and not have to waste time rereading that question on test day. So let's begin with that lead-in now. Which of the following structures is most likely being compressed by the abscess? Which of the following structures is most likely being compressed by the abscess? After that, we'd like to ask our students and audience how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. And an example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So please let us know in the question box how many steps you believe this question will require. You can also ask us questions in the question box, and our panelists will do their very best to try to answer those questions for you. All right, I see some responses coming in. Let's take a look at that vignette. A 10-year-old boy is brought to the pediatrician with a 4-day history of fever, fatigue, and right shoulder pain. His temperature is 38.6 Celsius or 101.5 Fahrenheit. On physical examination, he has right shoulder tenderness, worse at the right axillary region, and painful and weak abduction. On palpation, a swollen mass in the axillary region is noted. He also has wrist extension weakness and triceps hyporeflexia in the same limb. Sensory examination reveals absent sensation to light touch over the right shoulder and lateral and posterior arm. Imaging identifies an abscess in the right axillary region. The most likely diagnosis is an abscess. Which of the following structures is most likely being compressed by the abscess? Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and walk through what we think are the important clues in this vignette and the lead-in. And so starting off, generally, the first information you're going to get are demographics. In this case, we have a 10-year-old boy. Okay, so you always want to make note of that because that's automatically going to clue you in as to what kind of things you should be thinking about. Then usually they tell you, why are they coming to the doctor? Why are they at the emergency room? And in this case, it's because of fever, fatigue, and right shoulder pain. Okay, so you definitely want to make note of the presenting signs and symptoms. A lot of times they'll also tell you the chronicity of that. So how long has it been going on for? A few days, a few years, and in this case, we know it's been going on for 4 days. Okay, so that can automatically give you some clues as well. Now, in this vignette specifically, you can see that they give us a lot of physical exam findings, a lot of vital signs, physical exam findings with movement, on palpation, deficits, sensory and motor deficits. So automatically, where your brain should be going in terms of what kind of question this is. And obviously, we know this is an anatomy question. But you definitely want to make note of those because you're going to have to piece those together to maybe find out what the deficit here is here, what's going on here, okay? Now we do know that there's an abscess, and the question is telling us that there's a structure that might be, that is being compressed by the abscess, and we need to know what's the most likely one. So I think we've got a couple steps here. I think one, we've got to figure out maybe what's going on in this patient, and then two, what structure could maybe, if it were to be compressed, could lead to those findings. You know, you could argue that maybe that's just a big one-step question, but I think it's also important to kind of make sure you're separating it out. So let's go ahead and let's take a look at those answer choices. And what we'll see here are 5 answer choices. And when we work with students, we recommend that they go through the answer choices starting from the bottom and working their way up to the top. And the reason we do this is because a lot of times we'll see students who start at the top and they'll work their way down to the bottom, but halfway there, they'll see something they like and they'll select it. And without having gone through all the answer choices. And sometimes they'll get that question wrong. So we recommend doing it this way to prevent yourself from making that mistake and prevent yourself from biasing yourselves. So let's go ahead and let's do that now. Answer choice E, radial nerve. D, posterior cord of the brachial plexus. C, medial cord of the brachial plexus. B, lateral cord of the brachial plexus. And A, axillary nerve. So we'll let you guys take a look at those physical exam findings, give you one last chance to kind of accumulate those and piece those together. And we'll go ahead and open up that poll so you guys can select what you think is the best answer here. And we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. Keep in mind that there is no penalty for guessing on test day, so you should never leave a question blank. And if you're unsure tonight of what the answer is, don't worry. Take your best guess, and then we will go over the correct and incorrect answer choices together here in just a moment. I see the responses coming in. We'll give all of you a few more seconds here. All right, let's take a look and see what you selected. Clear favorite here, 42% of you selected posterior cord of the brachial plexus. In second place, we had axillary nerve, and the other 3 were pretty close. So let's take a look and see what the correct answer is. The correct answer is D, posterior cord of the brachial plexus. 42% of you got it right, so great job, strong showing out of the gate. Let me hand it off to Boris.
Thank you, Sean. So let's go ahead and talk about this question. First of all, great job on picking up on this. This is a very high yield topic in anatomy. They love talking about the brachial plexus and all the derivatives, but also a lot of those different palsies that you can get with specific deficits. Okay. So this patient, as we are told, has an abscess in the right axillary region. Okay. When you have structures or foreign bodies deep in the axillary region, you are at risk of compressing the posterior cord of the brachial plexus. Okay. Now you can see there in that little image, the posterior cord gives rise to both the axillary nerve and the radial nerve. Okay. If you have damage to the axillary nerve, you will have issues with shoulder abduction and loss of sensation over the shoulder, and we're told that. Okay. Now, if you have damage to the radial nerve, that would cause wrist drop and loss of the triceps reflex. Okay. And we are told that as well, wrist extension weakness and triceps hyporeflexia. Okay. Now, so let's take a look at the next slide, and this is our nice brachial plexus, a very, very high yield image and diagram. You can see there how damage to the posterior cord would affect both the axillary and the radial nerves, and you can see there specifically how that could lead to issues with the deltoid muscle, but also wrist drop. On the next slide, there's even a table in first aid that goes into it specifically nerve by nerve, and you can see there what would happen with axillary and radial nerve palsies, okay? And you can see there that kind of like we described, issues with sensation of the deltoid, issues with shoulder arm abduction, and then with the radial nerve, wrist drop, and then also decreased triceps reflex. All of which fits with what our patient has, okay? So if we go back to our question, you can see there that the posterior cord of the brachial plexus is the best answer. Answer choice E is not the best answer, okay? Because that would not explain some of the other signs and symptoms where that's being caused by a deficit in the axillary nerve. So E is not a complete answer. The medial cord of the brachial plexus, as you can see there, that gives rise to both the median and the ulnar nerves, but you would have different signs and symptoms. You would have issues with flexion of the wrist, issues with abducting and adducting your digits. You would have sensory loss on your palm and digits. Okay, we're not being told about that. If you were to have issues with the lateral cord of the brachial plexus, you can see that that gives rise to the musculocutaneous nerve and also a little bit to the median nerve. So you would have issues with elbow flexion. You would have sensory loss over the forearm. Not things that we're being told about. And then also axillary nerve, answer choice A, not a complete answer like we talked about with answer choice E. So the best answer here, like you guys picked, is answer choice D.
Well, great job, Paras. Great job, everyone. Let's move on now to our second question of the evening tonight. Once again, the answer choices are covered up, and we will begin with that lead-in. Which of the following structures is innervated by the most likely injured nerve? Which of the following structures is innervated by the most likely injured nerve? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll move on to that lead-in. Sorry, we'll move on to that vignette, rather. All right, I see some responses coming in. Let's take a look at that vignette. A 32-year-old man comes to the emergency department because of increasing numbness and tingling on the side of his right hand. 2 days ago, he sustained a crush injury to the right forearm at work. The initial injury was x-rayed and no fractures were found, and the pain in the forearm is now well controlled with ibuprofen. Neurologic examination reveals weakness of flexion in the fourth and fifth fingers and decreased grip strength. Which of the following structures is innervated by the most likely injured nerve?
Thank you, Sean. So we will go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we have a little bit of an older patient, a 32-year-old male. And we are told that he's coming in because of issues with his right hand, specifically numbness and tingling, okay? It's important then, you definitely want to ask about anything that could have happened. In this case, we're told about a traumatic injury, okay? We're told that there's no fractures. That's important, and that's also a good thing. But we do know that there are some neurologic deficits. And again, you want to piece together those deficits to figure out where the deficit could be, okay? Now, this question, they're then asking us about the most likely injured nerve and what is a structure that innervates it, or sorry, that it is innervated by. So I think we've got a couple steps here. I think one, we've got to figure out based on the signs and symptoms, what's the most likely injured nerve? And then two, a structure that is innervated by that injured nerve. So I think we've got a nice two-step question here. Let's go ahead and let's take a look at those answer choices. Once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E, skin of the palmar middle finger. D, skin of the lateral forearm. C, lateral portion of the flexor digitorum profundus. B, extensor digiti minimi. And A, adductor pollicis or adductor pollicis. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Thank you, Paras. The poll is open. Once again, we're going to wait until about 2/3 of you have responded. As you can see, we are going over the correct and incorrect answer choices today, and we encourage you to make that a habit while you're doing practice questions as well. See the responses coming in. We'll give all of you a few more moments here. All right. Almost there. Give all of you a few more seconds. All right, let's take a look and see what you selected. 35% of you selected lateral portion of the flexor digitorum profundus. And in second place with 28%, we had extensor digiti minimi. So let's take a look and see what the correct answer is. And the correct answer is A, adductor pollicis. And with that, I'll hand it off to Paras.
Thank you, Sean. Yes, definitely a tough question here, but also very important to know this anatomy. So let's take a look at what's going on. This patient is having issues with flexing the fourth and fifth fingers, okay? We know that for a fact, okay? So we've got to figure out what is the nerve that could be affecting that, okay? And that is primarily the ulnar nerve, okay? The fourth and fifth finger flexion is done primarily by ulnar nerve, okay? Now, the flexion, as we talked about with this ulnar nerve, if we take a look at the next slide, this kind of talks about the ulnar nerve, okay? And you can see there at the bottom left, if you have an issue with the ulnar nerve proximally, when you try to flex your hand or flex all your fingers and make a fist, you have issues doing that with your fourth and fifth finger, or the half of the fourth finger and the fifth finger. That's because you can't really flex that fourth and fifth finger because your proximal ulnar nerve is damaged, okay? Now, if we take a look at that other table, looking at upper extremity nerves, you can see that they call this the ulnar claw on digit extension, okay? You can see there that you have decreased flexion of ulnar fingers, okay? And that's what we have here, decreased flexion of that fifth and fourth finger, okay? Now, why is this the best answer? So the thing is, with flexion of these fingers is actually done through the medial portion of the flexor digitorum profundus. The medial portion of the flexor digitorum profundus attaches to the fourth and fifth digits. That's what's innervated by the ulnar nerve, okay? Now, the deep branch of the ulnar nerve also innervates the adductor or adductor pollicis, okay? So the deep branch of the ulnar nerve also innervates the adductor pollicis, okay? And you can see there that under presentation, that ulnar nerve is responsible for thumb adduction, thumb adduction. And that is one of the functions that the adductor pollicis contributes to. So if we take a look at our answer choices once again, you will see how A is the best answer, okay? We'll come back to answer choice C. Answer choice E, skin of the palmar middle finger. This is innervated by the digital cutaneous branch of the median nerve, okay, not the nerve we're talking about. Skin of the lateral forearm, that is innervated by the lateral cutaneous nerve of the forearm, which is a branch of the musculocutaneous nerve, and that's not, again, a different nerve. And for those who selected C, I know a good majority of you guys did, the lateral portion of the FDP is actually supplied by the median nerve. So if you had damage to that, you would have issues with flexing the second and third digits. What the issue is in this question is the medial portion of the FDP. And lastly, answer choice B, this is innervated by a branch of the radial nerve, which again is a different nerve here. So a nice anatomy question. Great job with this question as well.
Well, thank you very much, Paul. It's definitely a challenging question. You know, a lot of students simply haven't looked at anatomy in a while, but it's a good refresher. We're happy you all are here. You know, if you're studying and you want a little bit more support, you're thinking that, you know, I'm working really hard, but my results just aren't adding up to my efforts, or I should have gotten that question right, I'm not sure why I missed it, or I really need a good, efficient study plan, reach out to us at RX Coach. We'll help you make a personalized study plan. We can use your syllabus, your learning objectives if you're still in school, if you're studying for a comprehensive exam or a board exam, we can give you an assessment and base your study plan on that. Then we'll work with you to ensure that you're making progress, to identify and bridge your knowledge gaps, to do practice questions together on certain topics, and really ensure that you know how to apply what you learned. You know, as USMLE experts, we're able to really make your study more efficient and pinpoint your weaknesses to you that you may not be able to identify on your own. Students always tell us that after coming to us, their studying became more efficient, they saved time, and they got the results they wanted as well. So if you're interested in working with one of our RX coaches, please reach out to us at rx-coach or rx-coach.com. You can click on the free consultation tab to talk about the program and see how it can benefit you. Once again, that's rx-coach or rx-coach.com. All of our packages do come with access to all of our resources. We've got some wonderful success stories, students going up 80 points, 90 points, doing extremely well. We work with students who graduated 10, 15, even 20 years ago, and they've also been successful. And we'd love to make you one of our success stories as well. So with that, let's go ahead and get into our third question of the evening. Keep in mind that we do have a raffle and a special offer, so make sure you stick around until the very end because you must be present to win. Once again, the answer choices are covered up. That is by design. And we will begin with the lead-in. Which of the following is the insertion site of the muscle most likely involved in this patient's condition? Which of the following is the insertion site of the muscle most likely involved in this patient's condition? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. An 18-year-old woman comes to the clinic with a 1-week history of right hip pain. She runs track and reports that she first noticed the pain after jumping hurdles. The pain is achy on the anterior of the right hip and worse with activity. She also has noticed a popping noise in her hip. On physical examination, there is tenderness to deep palpation over the anterior hip. The hip is passively extended and internally rotated, which reproduces the pain and popping noise. Hip flexion against resistance also reproduces the pain. Which of the following is the insertion site of the muscle most likely involved in this patient's condition? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so now we've got an 18-year-old woman, okay? And they're telling us she's got right hip pain. They're also telling us that it's been going on for 1 week. So we have a little bit of information about time, okay? They're then telling us a little bit about what she does. So some social history. Whenever they give you that, you know, they tell you about a sport she plays, a job they have, you definitely want to make note of that because that could help you into figuring out what's going on. Specifically, they give us some information about where the pain is, where there's tenderness, physical exam maneuvers that cause pain and also popping noise. So you definitely want to make note of that because like we said, you're oftentimes going to have to piece these together to come up with a diagnosis. Now this question is asking us specifically not just about the muscle involved, but the insertion site of the muscle. So we need to know, one, what muscle is most likely involved based on the presentation, and then two, what is the insertion site of that muscle? So a nice two-step question here. So once again, we're going to go ahead and take a look at the answer choices. Once again, we will start at the bottom. We will work our way up to the top. Answer choice E, pes anserinus. D, patellar tendon. C, lesser trochanter of the femur. B, ischial spine. And A, greater trochanter of the femur. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. The poll. We'll wait until about 2/3 of you have responded. Once again, next week's topic is MSK. We hope to see you here. I see the responses coming in. We'll give all of you a few more moments. All right, a few more seconds here. All right, well, let's take a look and see what all of you selected. It looks like there's a clear favorite here. 40% of you selected greater trochanter of the femur, and distant second place was lesser trochanter of the femur. Let's take a look and see what the correct answer is. And the correct answer is C, lesser trochanter of the femur, and 29% of you got it right. So definitely a challenging question, but not to worry. Boris is going to break it down for us now. Boris.
Thank you, Sean. Yeah, it's definitely a tough question here. So let's take a look at what's going on. You can see here that this patient is having some pain on the anterior hip. And we know that this patient is a hurdler, okay? Oftentimes these patients, patients who do track and field, who do ballet, who do gymnastics, they have what's called tendinopathy of the iliopsoas muscle, okay? The iliopsoas muscle, you can get tendinopathy in that. That's common in those patients. And a lot of times, pain or popping noise is reproduced when you extend and internally rotate the hip, okay? Like they told us in this question. If we take a look at the next slide, this is a nice anatomical diagram of that iliopsoas muscle. And you can see how it attaches to the lesser trochanter, okay? Now you can see there also, just based on where that muscle is attached, how if it were to pull, it would cause a little internal rotation, okay? And it would be kind of pulling on it as well. It's a little bit of extension, okay? So that is a great way to think about how these muscles act. So if we go back to our question, you can see there that obviously lesser trochanter is the insertion site of the iliopsoas muscle. So one, it required knowing what muscle is affected with those physical signs, physical exam findings, but two, also the insertion site. So definitely needed to know both steps here. Now the pes anserinus, there's a few muscles that insert there. The sartorius, the gracilis, and the semitendinosus, but not involved in the pathology in this patient. The patellar tendon is the insertion point for a lot of your quads muscles, so your rectus femoris, your vastus lateralis, medius, and intermedius, okay? But keep in mind your quads are a hip flexor. The ischial spine, that is where your coccygeus muscle attaches, and some of your pelvic floor muscles attach, so a little bit different. And then lastly, greater trochanter. This is the insertion point for some of your gluteus muscles, your gluteus medius, your gluteus minimus, and your obturator internus. So also different functions there.
Well, thank you very much, Boris. Let's move on now to our last question of the evening. Let's try to finish strong. Once again, the answer choices have been removed. We will begin with the lead-in. The effective nerve is a branch of a larger nerve that controls which of the following muscles? The affected nerve is a branch of a larger nerve that controls which of the following muscles? I'll give all of you a few more moments as always to respond in the question box and let us know how many steps you believe this question will require. Then we'll move on to that vignette. All right, see some responses coming in. Let's take a look at that vignette. A 45-year-old man comes to the clinic because of shortness of breath and hoarseness for the past week. He was hospitalized in India during childhood hospitalization for a major febrile illness. He is found to have mitral stenosis with an enlarged left atrium impinging on a nerve. That affected nerve, the affected nerve, is a branch of a larger nerve that controls which of the following muscles? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so this is our 4th time doing this. So, hopefully you guys are getting a sense of what are those important clues in the vignette and the lead-in that you really need to pick up on to come to the best answer. Okay, and it's not just the vignette, but there are oftentimes important clues in the lead-in that you need to pick up on as well to really understand what they're asking you. Okay, so now in this question, let's take a look at what's going on. This is a 45-year-old male, and they tell us he's had shortness of breath and hoarseness, and they tell us specifically it's been going on for 1 week, or the past week. They tell us a little bit about his past medical history and physical exam findings. You can see this is a shorter vignette. Okay, so you definitely want to make note of those clues because that may be all you're given to come up with the correct answer, like in this question. Now, this question is specifically asking us about an affected nerve, okay, the affected nerve in this question, and it is a branch of a larger nerve that controls what muscle? So I think we've got a few steps here. I think 1, we've got to figure out what nerve is affected in this patient, step number 1. 2, what larger nerve is it a branch of? And then 3, what muscle is controlled by that? So I think we've got a 3-step question here. Okay, so a nice, tough 3-step anatomy question. So let's buckle in and make sure that we're nailing those steps one by one. Let's go ahead and let's take a look at the answer choices. Once again, we will start at the bottom and we will work our way up to the top. Answer choice E, stylopharyngeus. D, styloglossus. C, palatoglossus. B, mylohyoid. And A, hyoglossus. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we will talk about it in just a few seconds.
Right, as you can tell, the poll is open once again for the last time this evening. Let's try to finish strong here. Remember, next week's topic is MSK. See some responses starting to come in. We'll give all of you a few more moments here. If this is your first time joining us, please let us know at some point in the question box. We'd love to hear from you. All right. Almost there. Let's take a look and see what all of you selected. 38% of you selected stylopharyngeus. In distant second place was palatoglossus. So let's take a look and see what the correct answer is. And the correct answer is C, palatoglossus, and 22% of you got it right. So definitely a challenging question, but don't worry, just pay attention to Paris now.
Thank you, Sean. Yes, definitely a tough question, and definitely a tougher, what makes it tough is there are a few steps here. So there's a few areas or a few different ways where you could potentially get tripped up. So let's take a look at what's going on. Well, first of all, we're kind of getting back into a little bit of medical knowledge here. We've got a patient who was hospitalized in India for major febrile illness. Okay, and when we think about that, it's possible that this was a rheumatic heart disease issue. Okay, that this patient had strep infection and was not treated, and so then developed mitral stenosis as a part of rheumatic heart disease. Okay, and so that's kind of getting back into a little bit of medical step one knowledge, not just anatomy. Okay, now we then know, because of that mitral stenosis, we know that your left atrium can enlarge. Okay, one of the things though is that when it enlarges, it is at risk of compressing a specific nerve, the left recurrent laryngeal nerve. Okay, so an enlarged left atrium can compress your left recurrent laryngeal nerve. And this can manifest as hoarseness, like our patient has, okay? Because this nerve innervates the intrinsic muscles of the larynx, okay? So this is the recurrent laryngeal nerve that is affected, that is being impinged by the enlarged left atrium. That's step number one. Step number two is it asked us, what is the larger nerve that it's a branch of? And that requires us to know that it is a branch from the vagus nerve, okay? Then we've got to know what other muscles, and especially here in the pharynx and mouth, are affected by the vagus nerve. So if we take a look at the next slide, this actually talks about some of those muscles, and specifically the tongue muscle. You can see there at the very bottom, motor innervation to the palatoglossus is via cranial nerve 10. Okay, you can see some of those other muscles like the genioglossus, the styloglossus, that is from cranial nerve 12. Okay, so in this case, the palatoglossus is innervated by the vagus nerve or cranial nerve 10. So hopefully that kind of makes sense. If we go back and take a look at the other answer choices, the stylopharyngeus, that is the only muscle of the pharynx that's innervated by the glossopharyngeal nerve. Okay. The styloglossus, like we talked about, is innervated by the hypoglossal nerve as well. The mylohyoid, that's innervated by a branch of the trigeminal nerve, and hyoglossus is also innervated by the hypoglossal nerve. The best answer choice here is answer choice C. So definitely a tougher question, but a nice multi-step question. Great job overall on tonight's anatomy questions. Now pass it back to you, Sean.
Well, thank you very much, Paras. Great explanations as always. If all of you want to take a deeper dive here, review these questions in more detail on your own, or just take a look and make sure you didn't miss anything, here are the QIDs. You can simply type these into the RX search field, and it'll pull right up for you. So I'll give you a few moments here to make note of these or take a picture before moving on.